Heart failure. Heart failure or cardiac failure is the pathophysiological process in which the heart as a pump is unable to meet the metabolic requirements of the tissue for oxygen and substrates despite the venous return to the heart either normal or increased. Types of heart failure. Depending on output, it is low output heart failure and high output heart failure. Low output heart failure is further divided into systolic heart failure, diastolic heart failure. And other classification: acute heart failure, chronic heart failure, compensated heart failure. Acute heart failure is characterized by sudden development of heart failure. This suddenly reduces cardiac output and systemic hypotension without peripheral edema. Chronic heart failure is characterized by gradual development of heart failure and systemic arterial pressure is well maintained, but edema develops. Compensated heart failure is the term used to describe the condition of those with impaired cardiac function in whom compensatory changes have prevented the development of overt heart failure. Other classification is left-sided heart failure or right-sided heart failure. The left-sided heart failure is the most in most of the cases we find the left-sided heart failure. Symptoms of heart failure: dyspnea, that is exertional dyspnea, orthopnea, paroxysmal nocturnal dyspnea is present, nocturia is present, confusion, difficulty in concentration, impaired memory, headache, insomnia, anxiety is present, fatigue, low-grade fever, anorexia, nausea, abdominal fullness, pain due to congestion of liver and portal venous system is present. Anasarca is present, cyanosis is present, pulse volume is reduced, pulses alterance is a sign of severe heart failure. Reduced pulse pressure due to reduced stroke volume, JVP raised, presence of third heart sound is highly suggestive of heart failure. On percussion we find dull percussion note. Inspiratory capitation over the base of lung is hard on auscultation. Pleural effusion may be present, ascites may be present, pericardial effusion may be present. On investigation with a chest X-ray is done, it may reveal cardiomegaly. ECG is done, it may reveal previous MI, ventricular hypertrophy. Echocardiography is also done. Nuclear cardiography is done. Cardiac catheterization is done. It is useful in the diagnosis of ischemic heart failure. Ambulatory 24-hour ECG monitoring is done. And in treatment of cause is done, that is relief of symptoms and education of patient to explain the nature of disease, about the cause and treatment of heart failure. Measure to prevent heart failure, that is cessation of smoking, control of hypertension, diabetes and hypercholesteremia is advised to patient. Diet modification: diet low in fat, rich in fruit and vegetable and increased fiber is advised. Drugs we used in, that is diuretic drugs, is in furosemide 20 to 40 mg once or twice is given. ACE inhibitor is given, that is captopril 6 mg thrice is given. Enalapril also a drug that can be given in. ARB blocker is given, that is losartan 25 to 50 mg once or twice a day is given. Beta blocker is given. Aldosterone receptor antagonist is given, that is spironolactone 12.5 mg to 25 mg once daily is given. Digoxin is given, it is an inotropic drug. The combination of hydroxyzine and nitrates reduce the afterload and preload is given. And if medication fails, then device therapy is given, that is implantable cardioverter defibrillator is done. Coronary revascularization is done. And afterward, if this all not treat the patient, then heart transplantation is done.